portion is the cortex right here. And then this is the fibrous capsule, the brown part on the outside. This is the renal artery. This is the renal vein. Okay, so blood flow. So this right here is the renal artery. And so these are the segmental arteries right here. So they're also called lobar arteries. And then these right here, these are interlobar right here that you see going right here. These are arcuate arteries. They make an arc right here. They're between the cortex and the medulla, which is right here. These right here are called the interlobular arteries or cortical radiate arteries. And these cortical radiate arteries are where the afferent arteriole is going to rise from, and that will go into the glomerulus. So some additional structures here. So these are the renal pyramids right here, and they're in the medulla layer right here. All of these little dots that you see represent this thing that fell apart. So these are the renal corpuscles, these little dots. And the renal corpuscle has the glomerulus and it has the Bowman's capsule. So here, all of those are afferent arterioles that are arising from the cortical radiate artery right here, and they're going into the glomerulus here. So this here, if you include the white dot and all of the lines, the tubes right here, those are nephrons. Those are the filtration units of the kidney. You have about 1.25 million of them per kidney, with a total of about 100 miles of tubes. Okay, so this part right here, this is a proximal convoluted tubule right here. And this is a distal convoluted tubule right here. So the proximal convoluted tubule is connected to the renal corpuscle, and the distal convoluted tubule is going to be going into this tube that you see right here. The tube that you're seeing right there is the collecting duct. And the collecting duct is going to go down into here, and here we've got what's called a papillary duct, right where we have this nipple-like structure. So this nipple-like structure, we call that the renal papilla. And the renal papilla area here, we empty into the minor calyx. So each one of these is a minor calyx right here. And where the minor calyces come together, right here, this is going to be a major calyx. And then all of the major calyces are going to meet up, so you can see another major calyx right there. This part right here in the middle is the renal pelvis. And then coming out from there is the ureter. So this indented area where the blood vessels are entering and exiting and the ureter comes out, this indented area would be called the hilum. All right, let's zoom in now. Zooming in. So zooming in right here. Okay, so renal capsule, the fibrous capsule is right here. This is the arcuate artery and vein that's shown right here. So this is between the cortex and the medulla right here. So right here, the capillary ball here is the glomerulus. The afferent arteriole is branching off of the cortical radiate artery that you see here. The afferent arteriole goes into the glomerulus that you see right here. So the white ring that you see right here, that's the Bowman's capsule or glomerular capsule. This part of the tube that you see right here, that is the proximal convoluted tubule. And this is going to go down here. So this is the descending limb of the nephron loop. And then when it goes up right here, this is the ascending limb of the nephron loop. And you'll notice that when we get up here, that this part of the tube passes in very close proximity to the glomerulus and to the Bowman's capsule here. So these structures here, those are all renal corpuscles. And so the DCT that passes in very close proximity here, this is what has the macula densa cells. And those macula densa cells are going to monitor the filtrate that comes through here. All of these distal convoluted tubules are going to empty into the collecting duct that you see here, labeled with the number 1 right here. So multiple DCTs, distal convoluted tubules, are going to empty into this collecting duct. This collecting duct runs down through the medulla, and down here you have a papillary duct. And the urine is going to drip from here into the minor calyx. So the papillary duct is going to be down right about here, and the urine's going to dip into the minor calyx that you see right there. Now, surrounding the distal and proximal convoluted tubule are all of these blood vessel capillary network right here. Although we're not showing the tubes right here, they do exist right here. The blood vessels that surround the tubes are the peritubular capillaries, and they're involved in absorption and secretion. So you've got some that are around the DCT and the PCT right here. You also have some that are going to surround down here around the loop of Henle as well. And when they run straight, the name for this type of peritubular capillary, we call these the vasa recta because it just means literally like straight blood vessel is what it means. And so these are going to be involved in absorption and secretion here. So this is the vasa recta here, and these are peritubular capillaries that we see right here. Okay? And this one right here, you can see this is part of this blood vessel right here. And so this one right here is interlobar artery and vein right here. That's what you're looking at right here. Now zooming in even more. All right, zooming in. Afferent arteriole is here. This is a branch of the cortical radiate artery right here. And this afferent arteriole has adjustable diameter. So if you increase the diameter, you have more filtration here. So this capillary ball here, high pressure filtration occurs. The peritubular capillaries here, low pressure absorption and secretion. So here, this part is the Bowman's capsule and the glomerulus. So this is the parietal layer of the Bowman's capsule. This is the visceral layer of the Bowman's capsule. And the visceral layer contains the podocyte cells. So these podocyte cells create filtration slits here. And so what's allowed to pass here? Because these are fenestrated capillaries, solutes and water is very permeable. But because we've got filtration slits here, that means that protein and cells should not be getting into the filtrate that's right here. So this little space, this is the capsular space. This is where the filtrate ends up. 180 liters a day, if you include all of the, all of the nephrons here. And the filtrate goes into the tubular pole area. This is called the vascular pole, where the blood vessels go in. This is the tubular pole. And this has microvilli. That is a prominent feature of the proximal convoluted tubule here. About 65, 70% of reabsorption occurs here. Then we go through all of the loop of Henle, descending here, ascending here. And then we get over here, and this part is the distal convoluted tubule with the macula densa cells monitoring the filtrate. And you can see those right there. So that is the DCT. So that's the small one.